In the physical medicine and rehabilitation service work more than 25 physiatrists specialists, physiotherapists, occupational therapists, speech therapists, auxiliaries, monitor and administration. Due to its multidisciplinary nature, the rehabilitation team is also made up of specialty nursing staff and orthopedical technicians and health social workers. The students will be integrated into the neurorehabilitation unit and will develop all the daily activities with both the patients who have just been admitted and in the outpatient clinics. They will be part of the weekly and monthly sessions and committees that are held.
It's very important that the students have to be all the time very professional, because they have to be involved, of course, in the daily practice of the healthcare professionals. They can follow them, they can ask questions, but always with respect. Never the students can judge the way that the healthcare are working. This is very important. Always with respect, not only with the professionals, also with the patients.
The students will be observed and monitor acute patients for time they are admitted to the stroke unit in the general hospital, such as patients who are admitted to the neurorehabilitation unit for intensive rehabilitation and subacute patients who undergo treatment in the day hospital. They will also see the controls of a chronic patient in outpatient clinics where neuroorthopedic sequelae are controlled with treatments with toxins, botulinum and baclofen pump if needed.
The immersion in the clinical area will help the students to learn the procedures and the practice in a specific area, in that case in the rehabilitation area. So the way that the students will be able to find non-resolved solutions or needs will be by observation. They can observe all the time the healthcare professionals, also the hospital environment, the patients and the family. They can also ask questions. They can also make a focus group interviews, not only with the hospital staff, also focus group with patients to make sure that they understand how the hospital is going on and the experience that patients have when they are in the hospital, to make sure that they be able to understand the challenge and the major problems that we have in the hospital. Also, they can have surveys with experience in the patients and a community of practice.
We identify three: ongoing cognitive, visual and visual perceptual disorder of the patient with acute brain injuries not adequately addressed, insufficient psychology support to the patients and caregivers in order to facilitate the neurorehabilitation of patients with acute brain injuries and its adaptations to disability, and the last, lack of structured information from the multidisciplinary team to patients and families, caregivers under rehabilitation. The students will join the neurological rehabilitation unit, where comprehensive and intensive care is given to the patients with a stroke and head trauma or acute brain damage. Students will be able to view and participate in the different treatment modalities with physiotherapy, occupational therapy, speech therapy, swallowing disorders and neuropsychology.
The first one and the most important is that they have to be able to learn an open mind, because this is a huge opportunity. They have to know that make a clinical immersion, it's a big opportunity to find different challenge, to find possible solutions. Also, they have to understand before make a clinical immersion, to understand all the protocols of the hospitals, and to know the privacy of the patients and the confidentiality of the patients. This is very important. And finally, they have to respect all the hospital environment. So make a fun in the clinical immersion and learn a lot and be open-minded.